got, Carlene?
I got a 13-year-old. He came by ambulance. His mom was with him in the room. Apparently he was in PE class and took on a challenge to race and had an asthma attack. He's got a history of asthma. The nurse came down, saw him, and gave him his inhaler, and that wasn't working, so they called the ambulance.
Okay.
So she's a little bit nervous, of course. He's got an IV in his right antecubital, saline locked. He is on 2 liters of oxygen. Yeah, and that's about it right now. I was getting ready to go in to do vitals for you.
I'll meet you in the room. I'm going to call the lab. I'm going to do a stat, ABG, and a CBC on him. I'm also going to call diagnostics and get a chest x-ray stat.
Okay.
And I will meet you in the room.
All right, sounds good. I'll go get his
Thank you.
vitals. Hi, Byron. I'm Carlene.
Hi, I'm Byron's mom.
Nice to meet you.
Nice to meet you too.
All right, Byron, we're going to go ahead and get some vital signs. Basically, we're going to get your blood pressure, we're going to get your temperature and that kind of thing, okay? So just hang tight. I'm going to raise your bed up.
Are you doing okay? Byron, you doing all right?
Let's try to get your temperature real quick. I need you to stick this under your tongue and just hold it still. Doing okay? Doctor's going to be in just a little bit.
Well, I'm really worried about him. This is the first time he's ever had to come to the hospital because of this. Yeah.
This has happened before though, right?
Yes, it has.
And you were able to...
Before his inhaler was able to help, but now this time the nurse said that it didn't do anything to his breathing just got worse.
Just hang tight, Mom.
Okay, all
Look
right.
after him. Like I said, the doctor's going to come in. He's great. You'll like him. He's really tall. Oh, there he is.
Hello, are you Byron? Hi, Byron. Byron's mom.
I am.
Byron, we know what happened to you, and the biggest thing that you can do to help us right now is just try to relax. We know you're having trouble breathing, but we're going to give you some medicine that's going to really help you with that, okay? So we just don't want you to worry. We don't want you to worry, Mom.
Okay. I'm a little nervous here today.
He's in good hands.
Okay.
And we're going to be able to correct his problem pretty shortly, I anticipate. So Carlene, what'd you get for vital signs?
Blood pressure is 105/70. His pulse is at 95. SaO2 is 90% on 2-liter nasal cannula. Respiratory rate is 30, and he's got a temp 36.7.
Okay, some pretty short, shallow breathing. Why don't we bring the bed up all the way, high Fowlers, and why don't we bump his oxygen to 6 liters?
Am I in your way here?
No, we're good.
Okay.
Although I couldn't get it to work over here. Isn't working.
I'm just going to take a quick listen here, long hair, Byron.
6 liters.
It's diminished, which is what I would expect. I'm going to look at some of these labs I think are in here, Carlene.
Okay.
You can document this for us in his chart.
Absolutely.
His pH on that ABG is 7.46.
Okay.
Just slightly alkalotic. We have a PaO2 of 78, PaCO2 of 34.
Okay.
So it sounds like we're catching him in his early stage of distress, so
Sounds
I
good.
think we'll be able to turn him around pretty quick. His CBC, his white blood cells are 6.2, he's in normal range.
Okay.
And the chest x-ray did not show any excessive fluid or anything abnormal.
Okay.
So is this something we need to be worried about? Is he?
I understand that this is the second time it's happened to him this year.
It
and that
is,
the inhaler
yes.
just didn't work.
Right. I think he's just not using it like what he should be.
We're going to give him a couple treatments that are going to help him, and then at the end, before we discharge him, we'll give you some instructions. We're going to leave you with a new medication today, perhaps, as well.
Okay. All right.
All right, so it looks like you like the Wenatchee Wild, huh? You a big fan?
Yeah, respiratory therapy. This is Dr. I in room 36.
Yeah,
We need
he likes
a
whatever she wants.
stat albuterol neb treatment for our patient
Yeah,
here.
I think.
Thank you.
So, what are you getting in here? What was that?
We're going to give him an albuterol. It's similar to what he gets in his inhaler, but
Oh.
we're going to give it to him in a different route
Okay.
where he'll be breathing it in, and it'll be more effective for him.
Okay. All right.
Hello there. My name's Gabriella, and I'm the respiratory therapist. I'm here to give Byron
Yes, this
a
is my son
nebulizer,
Byron. Right.
albuterol
Uh-huh.
nebulizer treatment, and what that's going to do, it's going to help relax the muscles and open the airways so
Okay.
he can breathe better, and you'll feel a lot better after the treatment, Byron. First,
Okay.
I'm going to listen to your lungs.
Am I in your way? Am I
No,
in?
you're
Oh,
fine.
Okay.
Okay. Okay, Byron, I'm just going to have you breathe this in through your mouth. And you're going to feel a lot better after.
And as you start feeling like you're breathing a little better, Byron, you might try to take some deeper breaths with that, just to really get it in your lungs to help open things up for you. You know, Gabby, I'm thinking just to maximize this anti-inflammation here and open him up, after he's done with the albuterol, I'd also like to do an Atrovit.
Do you want me to do it right after we assess the lungs and then do that?
Yeah, if you could.
Okay.
And here's our plan, Mom. We're going to give him 2 breathing treatments, which Gabby's setting up the second one now.
I'm going to go ahead and take that.
And we're going to watch him for 1 to 2 hours.
Okay.
Some of these treatments don't peak in effectiveness for a full hour.
Okay.
And make sure he's doing real well. And then we're going to come back in the room and with the nurse, and we'll have a discussion on medications we're sending home.
Okay.
Just some discharge instructions for you.
All right. That sounds really good.
See if we can't prevent this from happening again in the near future for you, okay?
Okay, Byron, we're going to go ahead and give you the second treatment. Same thing. Go ahead and just breathe it in through your mouth. Take deep breaths if you can.
It looks like he's feeling a lot better. Byron, are you feeling better? Yes, okay, good.
Looks like that's all gone. I'm going to go ahead and take it. How are you feeling? Good? You feel like you can breathe better? Let me listen to your lungs for the last time. Okay, seems like treatment being effective. There's some bilateral wheezing, but his breathing sounds a lot better.
Okay. So Byron, that medicine's going to help you out, and you're still going to feel a little funny in your chest because your heart's still going to be pumping pretty hard. Because part of the side effect of that medicine, it opens up your lungs so you breathe better, but it's going to increase your heart rate for a little while, okay? So we just want you to kind of rest and relax. Mom, here's the call line if anything,
Okay.
if you need the nurse for anything.
Okay.
And we'll be back in about an hour, and we'll meet with you
Okay.
with some medications we'll be discharging you with, okay?
All right.
Can I get you anything? Are you okay?
I'm just fine, thank you. Hi, Dr. I.
How's it going?
It's going really good. He's doing 100% better.
Byron, how you feeling? A lot better? Okay.
Good. Glad to see you smiling.
I see that pulse ox. You're up to 99. That's good. That's a number we like.
Good.
Okay.
Okay,
So here's the plan.
Okay.
We know Byron's already had his inhaler, and we're going to continue him on that. Okay.
Okay.
We're just going to talk to you a little bit about it, make sure you're using that properly. We're also going to give you a second medication. This is called a steroid medication.
All right.
And we're going to try this for a little while. And we're hoping to see that he doesn't have any more of these episodes with the steroid, okay?
Okay.
It's not something we're going to be continuing indefinitely. The important thing about the steroid is we're going to leave you discharge instructions. Okay, Byron, I want you to listen to this too. The steroid is always going to be used 5 minutes after your regular inhaler. Okay, so use your regular inhaler first. And the steroid is going to be used afterwards, and we want Byron to rinse his mouth out every time after he uses the steroid.
Okay.
We also want you to report to us if he has developed sores in his mouth, any white patches. If you get a sore throat, Byron, and it just doesn't seem to be going away. Also, it's important to report any blood in the stool or black tarry stool. Okay. And his immunity gets reduced slightly with this steroid, so make sure he's up to date on his immunizations. Make sure you wash your hands really good before you eat, Byron. And that is nutrition, you know, feed him really well, nutritious meals.
So how long will he be doing this additional medication for? Is it a certain length
Well,
of time?
we're gonna do a follow-up in a couple months with you.
Oh, okay.
And,
So, but it's just every time he uses the inhaler, he uses the additional.
every time he uses the steroid,
The steroid.
we'll have it set up with your instructions that he
Okay.
first uses his inhaler 5 minutes before the steroid.
Okay, that's
The
okay.
inhaler is going to open up his lungs and allow the steroid to really get in there and be effective.
Okay, I understand now.
Now the other thing too, Byron, is your inhaler you've been using, we want to make sure you're using that properly, okay? And I know the school holds that for you for emergencies. Even when you're not at school, you go for a hike, go playing football with your friends, we want you to carry that with you at all times, okay? And the things that are important to remember about that is you want to shake it up. The canister's held upright. And when you depress that, we want you to breathe in slowly and really deeply for like 3 to 5 seconds. It's not like it's like press it. And we want you to hold that for up to 10 seconds, hold your breath. And then exhale through your nose, okay? And what happens, Mom, is kids get embarrassed about using that properly.
Yeah.
They don't want their friends to see they're using it.
He is a little bit.
And that's probably part of what had, it's part of the reason you got in trouble, okay? And when they did give you the inhaler at school, we weren't there to observe it, but we don't know if it was used properly. You know, it really rescued you. So every time you use it, we want you to concentrate on that technique, okay?
And we can practice that.
And then when you're away from home and not at school, we want you to carry it with you at all times. And if you feel like you can't breathe, that's the one you use as your rescue inhaler. And the new medication we're giving you is never used for emergencies.
Oh, okay.
That's kind of a long-term medication,
Okay,
just to help improve his lung efficiency, okay?
good.
Make sure you're also doing regular exercise. Don't be afraid about exercising. It's important to exercise with the asthma. And if he starts having any unusual weight gain, give us a call.
Okay.
Okay.
Now, does he have a follow-up appointment that you want to see him, or just in a couple months, or unless something happens?
We'll go ahead and schedule that for you.
Okay,
We'll go ahead and
that'd
schedule
be great.
Carly will
We'll do
give
it
you
in the
that.
office, so you don't have to come to the emergency room,
Okay.
hopefully.
Perfect.
I'm going to go ahead and remove your IV and get everything off so you can get home, okay, and get some rest, all right?
Any questions, Byron? Any questions, Mom?
No, thank you guys very much. You
Yeah,
guys-
any
you
questions,
guys are
anything
awesome.
comes up, just call us.
I will, definitely.
Or call your provider, make sure you follow up on that, get the information. Okay.
All right, thanks.
Okay, thanks,
Okay, Byron.
guys.